think when you're undergoing any medical procedure, and I do consider Kshar Sutra to be a medical procedure, that it's so very important to listen to your doctor. So I'm not advocating going against your doctor's orders or instructions if whatever I say and everything that I say in any of my videos is just my opinion and it's just based on my experience. Experiences will differ from person to person, situation to situation. But with that being said, as long as what I say doesn't go against what your doctor tells you to do, I do think that there's a few things that you can do to make your Kshar Sutra treatments more comfortable. And the first, at least as far as my doctor's advice was to walk, because the walk helped release the medicine in the threads. And some of the medicine is anti-inflammatory, some is antibacterial. And of course, with the area constantly being rubbed by this thread, inflammation can occur. So the more medicine that is released, and the more it can work through the area and keep those nasty things down, like inflammation or bacterial growth. So I think walking is super, super important for your overall health, and as well as helping the threads work through as quickly as they can. Another thing that my North American doctors didn't address, but I think that should be addressed with any medical procedure, is your diet. For my procedure for having Kshar Sutra, my doctor recommended that I eat a vegetarian diet, no dairy, no spicy food, no processed foods, no meat. And that is because if you eat meat or dairy, that could make your stools more firm, or could make you more constipated. Not like, I haven't gone in a day or two or three. I don't think it's constipation on that serious of a level, but it could just make things a little more, how do I put it? As it's going through your digestive tract, it could be a little more hard to push through, which could, of course, hurt the area, because down there in your rectum, you've got this open wound, and you don't want stool coming through that's any firmer than it needs to be. And I know that when I had my abscess drained in Canada, my general doctor and also my surgeon at that time recommended stool softeners to make sure that my stool was soft and that things were coming out and not hurting the area. What I love about my doctor's approach, he's more into the holistic approach to medicine. So he didn't recommend that I take drugs to keep my stool soft. He recommended that I engage in these dietary changes, and I have. Pardon me. I have, and I will say that from my experience, it has certainly helped things come out more easily, and it's a lot softer and a lot easier to pass. So it certainly made my trips to the bathroom a lot more comfortable than they most likely would have been if I had been eating things that were either agitating my digestive tract or making my stools more firm. I would definitely also recommend that you drink a lot of water, and that's just, of course, always good for your overall health, but it's also good for your digestive system to help make sure that things are moving along as smoothly and as efficiently as possible. I think not just for having medical procedures, but just for anything in life, I would highly, highly recommend that you get the recommended 8 hours of sleep, if at all possible. So much regeneration and healing takes place when we're asleep. And if you're having any medical procedure, it could be an anal fistula, or it could be having a tooth removed, it could be anything. I think sleep is so very important to allow your body time to rest and to heal as quickly and as well as it possibly can. Even though, at least in my experience with my doctor, even though the procedure was as gentle and as painless as it possibly could be, you're probably going to come into periods where the area is uncomfortable, or it's tender, or it could be painful. And so I would recommend that you don't be afraid to take painkillers if you need them. Certainly don't take more than you need. I think that would wind up causing other problems. I don't know, but that's my opinion. Perhaps it could. But don't feel like you have to tough things out, or that you shouldn't be taking pain medication at all. It's a very, very sensitive area, so naturally things will be uncomfortable, things might be a bit sore, or they might hurt. And if you need to take pain medication, by all means do it. And you should have this is with any medical procedure again, but especially Kshar Sutra if you're coming from a foreign country into India, you want to make sure that you have a doctor that you absolutely trust and that it's somebody that you're able to reach if you have any concerns about what's going on, so that they can help set your mind at ease as you're going through this process. So an example of that would be, as my Kshar Sutra thread was cutting through my anal area, one time I went to use the washroom and there seemed to me to be quite a bit of blood, which of course just alarmed me. There had been blood in the toilet before, but this time there just seemed like there was a lot, so I quickly texted my doctor, "Oh no, there's a lot of blood, is that normal?" And of course, he's very responsive and very good at taking care of his patients. He said, yes, it's a sensitive area, and that's not out of the ordinary that you would have bleeding there. So even though I figured that that was what was happening, it was just hugely reassuring to have my doctor tell me that this was normal. And I think that if you're stressed out with coming to India, if you're a foreigner, the culture is different, everything's so different, and there's so much to take in. The last thing you want to be worried about on top of that is having a procedure and you don't really understand what's going on, or you have concerns. So I think you should make sure to choose a doctor that you absolutely are comfortable with, that's going to be quick to respond or able and willing to respond to your questions, and one who is good at explaining what they are going to do as far as your treatments before and after. And that's a practice that my doctor does, which I really, really appreciate. Before he does anything, he explains what he's going to do. He explains as he's working. And then after each appointment, he takes me into his office and he says, what he saw, how things are progressing, and what he thinks will happen down the line as far as how he thinks the healing will take place. So that's very, very, the trust between doctor and patient is very, very important. If you believe in meditation, I would certainly recommend that you undergo meditation as far as just to relax yourself. And if not, I definitely would recommend that if at all possible, you try to focus on your healing and not focus so much on issues that might be going on back home. If you're able to not focus on those things, because sometimes it's just not possible. But stress can depress the immune system and cause healing to take place more slowly, at least as far as my research has told me. So it's very, very, very important, in my opinion, to try to be as stress-free as you possibly can as you're undergoing Kshar Sutra or any medical procedure. Just so that, I guess, basically so that your body, your mind, your spirit is focused on healing and not focused on something else. Depending on where your fistula is located, it might, and depending on how you sleep, for example, I'm a side sleeper, putting pressure on the area, especially if it's directly after a treatment, might cause it to be a bit more irritated than it normally would. So a tip, in case anybody hasn't thought of this already, I'm sure a lot of people have already though, would be to just take a pillow and place it between your knees so that they're not smushed together and putting more pressure on the area than would be if you didn't have a barrier between your two legs. It just kind of takes the pressure off of things and makes the sleep or the lay down more comfortable. And you could probably do the same thing if you sleep on your back or on your front. Just take a pillow and put it in an area that can help take the pressure off of wherever your fistula is located. Which is something I didn't realize when this whole journey started, is that when you have an anal fistula or an anal abscess, it's not really an area that gets any rest. It always has pressure on it, whether you're laying down, if you're asleep, if you're sitting, if you're standing. So sometimes I found for me that a pillow often helps just to take pressure off of things. Even though my husband laughed at me for my suitcase full of medication before we came, because I take lots of herbal supplements and probiotics, I wanted to make sure to pack a probiotic that I normally take at home, because whenever you travel somewhere, there's different bacteria in the area, different bacteria just around and in the food, and that could lead to traveler's diarrhea or bowel discomfort. And I wanted to try to ease that as much as possible by having probiotics that contain the same bacteria that my intestines are used to. So I would recommend if you take a probiotic, or if you're interested or open to taking a probiotic, that you look into that, especially if you're having surgery in the anal area, because you want things down there to be running as smoothly as possible. And so you're not going to want, I would imagine, I didn't want to come to a different country and know that the food is different, there's different bacteria, and upset the balance of my gut even more than it needed to be by having my gut flora go from being one way to a really rapid shift to a whole different way. So that's why I chose to take probiotics with me to try to keep things as normal to what I'm used to at home as possible. Even though it's really important to focus on the medical aspects of trying to help your Kshar Sutra treatments and journey along, shouldn't ignore the spiritual or the emotional aspects. So I would also recommend that whatever it is that you have at home that you love to do, for example, if it's knitting or doing puzzles or reading or watching comedy movies or whatever it is, that you try, if you're able to bring as much of that as you can when you come here, because, like I said, there's a big culture shock. If you happen to be making the journey alone to have Kshar Sutra, then you might be in the position where you find yourself in a different country. You don't know anybody, you don't know the customs, the language. It's just such a culture shock. And to have to do that alone can be, for a lot of people, very distressing and depressing and uncomfortable. So I would certainly recommend that whatever you're passionate about, that you bring it with you as long as you're able to. And as frivolous as it might sound, but we're talking about things that make you feel good inside, nourishing your soul. I have a real obsession with nail polish. I just love colors. I love nail art. It's a really nice outlet for me. And so I made sure to bring a good chunk, from a normal person's standards, of nail polish from home, just because I knew that it would provide me with a bit of comfort to, I call them my paints, to have those with me. And if I were bored or, missing things at home that I normally enjoy, I could sit and paint my nails and do little designs and do nail art. And that would just be something that helped pass the time, because there is a lot of downtime when you're having treatments. It would help me pass the time. And also it would just be something that brought me joy. So try not to neglect your spiritual health and your emotional health, whatever it is that you enjoy doing, writing, whatever. Make sure to take that with you if you're able to. I was very, very, very fortunate in that my husband was able to travel with me, so it wasn't just a journey that I made alone, which can be very lonely, cause a lot of homesickness, and I think for a lot of people you'd kind of become homesick after a while anyway. But I think that the journey is easier if you have a loved one, a partner, or a travel buddy to come with. So I know that there's a lot of people who just don't have the option of taking somebody that they know or care about with them. But I would recommend that if you can take a travel companion with you, that you do, just to help with the loneliness, the feelings of possible isolation, safety, just to have somebody to offer you support and comfort and friendship. Because when you're going through any sort of medical procedure, I think that it's kind of a time where you can feel very, very vulnerable. And it's just very important to have people, if you're able to have somebody there with you who can help you along. Even if it's just a matter of having a laugh with your travel companion or sharing a moment. I think that on any journey, and I do think that traveling to India and having a medical procedure, getting your life back, is a huge, huge decision and a huge life journey. It's a huge moment in your life, one that you're never really going to forget. But I think that a lot of the important things in life are lived in the special moments that are maybe considered more mundane. And at least for me, having my husband able to be here with me has helped just make the entire journey so much better, because it's not just hitting the high points and that's it. It's also being there during the lulls and during the more mundane times, which is where I think the important things in life are really lived. This is more along the travel aspect, but it also plays in with the spiritual and the emotional well-being of you as a whole individual, not just looking at the part of you that's broken, which would be, your anal area. But you should make sure to stay in a hotel or a motel, an apartment, just a location that is safe and that you feel comfortable with. If you don't feel comfortable, then certainly look into staying someplace else, because it's very, very important to be able to come to your home away from home and relax and enjoy your experience as much as you possibly can. If you have any treats that you normally enjoy, I think sometimes it's okay to treat yourself. Of course, everything is different here, which would include the candy bars or the chips. So if you see something and it's familiar to you and you enjoy it, don't deny yourself, the pleasure of a small chocolate bar, if that's something that you're not used to eating and it's just familiar and it would give you a little bit of joy. One thing that I have always loved, not always, but one thing I've recently discovered that I love is just sitting and having a cup of chaga tea. It is a herbal tea, and it's great for all kinds of health things. It's good for your immune system, your digestive health. I made sure to bring a healthy supply of that with me, just because it was part of my routine, and I wanted to try to keep my routine, some aspects of my routine as normal as possible, just because that would also bring me some comfort. And of course, I wanted to continue reaping the health benefits from that as well. So if there's things that you normally use for your daily routine and you're able to bring them with you, I would highly recommend that. Because your life, when you travel anywhere, but especially if you're coming here for Kshar Sutra and you're going to be here for a long time, your life is already going to be interrupted greatly. So you would want to try to minimize that in any way you can. Before we came, we chose to have vaccines. I think we had typhoid and malaria. We had made sure that our measles, mumps, rubella was up to date. We had another vaccine that I can't quite remember. And this is a personal decision, and travel vaccines are not cheap by any means. At least they weren't for me. You might want to consider making sure that your vaccines are up to date, or taking some travel vaccines as well, because you certainly don't want to come to, a different country and you get sick with something that maybe you could have prevented by taking a travel vaccine. And with that being said, for me, I know that my bowels, how do I put this? They can become upset depending on what I eat. And that's not necessarily something as drastic as the different foods in India. It could be anything, So I would definitely recommend that you be cautious about drinking bottled water, about what fluids you drink, where you drink them, if it's a street vendor or not. I personally wouldn't recommend that you eat from a street vendor, but if you do, that is your choice. This is just, my opinion, and I'm not an expert by any means, and I'm not a medical professional. But you might want to consider being cautious of where you eat and street vendors, and making sure that if you do have a fruit or a vegetable and you do choose to eat it, that maybe you want to consider peeling the skin off or washing it, just so that you aren't ingesting contaminated food or contaminated water, which could make you sick, on top of having to go through your medical procedures. As you're going through your Kshar Sutra treatments, if that's what you're doing, as the thread is cutting through, it is creating an open wound, even though it's cutting and healing at the same time. It is still a wound. And so you're going to definitely want to make sure that you keep that as clean as you possibly can using water. I would recommend that you use water and only water, not necessarily soap. I don't think it's necessary. My doctor recommended that I only use water when cleaning up after myself. And I would recommend that if you happen to have a bit of cotton in the area to catch any pus or drainage, that you change that frequently, just to make sure that the wound is dry and that it's not always in contact with pus or stool or anything like that. You want to make sure that the area is just as clean and dry as possible, and that your area, if your body is responding anything like mine, there's going to be, pus coming out of there, which can be really irritating if it's sitting on your skin for a while. Pardon the change of scenery and the really poor lighting, but I just wanted to also say that my doctor recommended I don't swim or get into a hot tub while I am undergoing Kshar Sutra treatment, and you should perhaps talk to your doctor about that as well. And if your doctor recommends the same, certainly make sure to listen to your doctor.